So hello from ChriSOULa, the Golden Muse. On today's episode, I've got here some absolutely amazing people that have come together, collaborating, working towards a vision that has got a very special place in their hearts. And I would like to showcase and share with you this possibility of working and understanding what WHIS is all about. And WHIS stands for World Health Innovation Summit. And I would like to welcome Gareth Pesh, Saeed Ali, Jackie Wilson, and Sue Cooper, and hopefully Maxine Robinson will be joining us in a little while to this episode of getting to understand the importance of connecting with our emotions, connecting with what's happening in our lives in a conscious way, and what steps we can take to really improve our health by starting with a health service, starting with helping with the community, the schools, teachers, parents, all working together. So the actual motto is together, inspire together. Together we inspire, something like that, isn't it, Gareth? Yes.
Together we inspire. That's our motto.
Yes. So in the next few minutes, we're going to be sharing with you what WHIS is all about. And WHIS has actually started 2.5 years ago. It's an organization that helps the health, but also well-being, and works with teachers and works with children, and has got a lot of good values there that Gareth is going to share with us. So Gareth, welcome. Will you please share with us here and everybody who's going to be watching back again a little bit about your passion and purpose about WHIS?
Sure, thanks very much. And good evening to your listeners, and for those watching live or on recording. So my name is Gareth Pesh. I'm the founder of the World Health Innovation Summit, and you may be asking yourself, well, what is the World Health Innovation Summit? Well, it's a platform that I set up 2.5 years ago to support the health services while also creating vibrant communities. So what we have is a platform where we bring people together to share knowledge to improve the health service. It's quite simple, actually. What you do is health touches us all. So you bring patients, clinicians, managers, voluntary sector, education, and the business community into one space so that we can all share our ideas, and we co-create, we co-design so that we get a positive outcome. The idea is to alleviate pressure and stress on the system, and we all know that the system is under immense pressure at the moment. And then the aspect that we kind of have brought in when you mentioned about kids, so we have to look at prevention. So we set up programs within the schools with kids. So in the last year, we've delivered WHIS Kids programs, which is health, wellness, and mindfulness within those schools. 15 schools and about 1,000 children to the programs. So we're now starting to see the results of our activities within the community. And then we have programs which are WHIS at Work, which is related around stress management within the workplace. WHIS Seniors, which is care homes, falls prevention. We've WHIS Green, which is looking at our environment, energy, waste, and water, key components of our health. And then we have like WHIS Talks, which is similar to a TEDx, only bringing local influencers together and sharing their lived experiences, and then effectively sharing knowledge. And we've established this in Carlisle in Cumbria 2.5 years ago. And the model is that we share this model into every local community so that it can be replicated. But it's very much a local initiative, so it's very much about local people. And that's thankfully Sue, Saeed, and Jackie have taken the initiative to Nottingham. And that's kind of a very broad overview of our activities, but we're involved in local, national, and international activities.
Yes, because you are connected with various places in the world, including Africa, and it's amazing how you have actually spread out. So it's based in UK, but not only; it's international.
So basically, it's a collaborative network. And it is international. And how we've been able to drive this is through social media. So we never had that platform, those tools before. So we use effective social media to spread the message. Facebook, Twitter gives us enormous reach, and then you just connect with like-minded individuals who are interested in supporting the health service, and also supporting local communities. All of our activities are aligned to helping local communities. So even though the platform is a World Health Innovation Summit, it's actually local. So we focus very much on local. So, and a lot of great initiatives happen locally. And then we just give that space and that platform. That knowledge can be shared very quickly digitally then. And then it's co-design. It's a very powerful tool.
Well, talking about local initiatives, I will come to you, Sue, because you recently, this year in May, you created a mass mindfulness meditation in Nottingham, in the very heart of Nottingham, and it was absolutely amazing. You had 1,000 people coming together, and all of them sort of under a guided meditation together, saying yes to mindfulness and say yes how you connect more with your heart and more, bring more peace into your life. So what is your take about WHIS?
Well, I'm still learning about WHIS, but from what I'm learning very quickly, it's like looking into a mirror. It's the very same values that we at Unplugged Space and from a personal perspective have been seeking for a very long time. It's having. I feel that there's many of us who are very prepared for this. We've been doing our own trainings within the holistic framework, and now we have got this wonderful foundation in community, as Gareth says, at the heart of change. So the Unplugged Space Think Nots event was a showcase for that, and we wanted actually to bring the word meditation into awareness, because mindfulness is a consequence of meditation. We wanted to bring it so that people were aware that there's nothing to be worried about meditation, and to experience it. And those people came from all over the world. I mean, we had people from America, quite a lot of people from America actually, from Ireland, and bringing those people together. They've now gone back to their own places, having felt it, and now cascading it out, and the collaborations have started. So in answer to your question, I do believe that WHIS has got the most wonderful global reach, which is very important because of the collaboration across the world. But the essence is a grassroots movement. So it's each community taking on its own beauty, its own heart, and with that, devising something within that framework of that WHIS is offering. So our logo for Unplugged Space was or is creating a vision of peace and hope. And with that, it's the co-creating of compassionate communities. So it's all those C's. And when we create compassion within our community, then there's a shift. There's a shift out, because care and coherence and creativity and all these other wonderful words starting with C, collaboration being one of the main ones, happens. So I'm delighted to be part of this platform today. And thank you, Gareth, for what you started. You started a ball rolling, and we're all there ready, and we'll move it forward together.
Yes. It's great when there's a leader, but also the leader needs other people to work together and collaborate, and that's what we're here for, aren't we? So I would like to just at this point to bring in my own sort of passion about it, because when Jackie talked to me about WHIS, I've been looking forward to connecting with people like you for a long time, because I've been a teacher for many years now, and I left the secondary school education because there was something there that was not sort of, in congruence with me. There's something there that I could see that I was going against the flow. So now, though, I'm in a different place, and I'm connecting with people like yourselves, and I would love to see what we can do, bringing meditation and mindfulness and the WHIS programs you'll be talking about, Gareth, and everything you have set up so far, and what we can actually create more, because there's more to be created in collaboration with others. So I think. Yeah. Sorry, Gareth.
Yeah, sorry. I was going to just say it's all about the people. Like you see the people in this shot here, and what's great is like we talk about leadership, but there's great leadership out there, and it's tapping into that leadership. And one of the key aspects of leadership, I was only just talking about this today in the NHS, is empathy, which is often overlooked as a key trait of leadership. Unfortunately, it's not recognised widely as a value of leadership. However, the health service has that in abundance, and I know from my experience, and I hope others would share the view that we have that in abundance in our society, and the WHIS allows that to flourish, and it will come to the fore, because what you see in the picture here is people with passion to help people within their communities, their local communities. That's what we're enabling here. We're giving that oxygen so that it grows. And it's very much a platform that people have opportunity to take, because it's a global platform. It's not just a local platform, it's a global platform. So you can help your local community, but then also impact on the wider aspects of society. That's what the beauty is of what we're doing, because you can come up with a eureka moment and then share that widely, so that someone in India or someone in South America can actually benefit from your concept, your idea, your innovation. And I very much believe in this paying it forward, sharing, because I believe the more you collaborate, actually the more you grow, and it's good for business, it's good for people, it's good for the economy, it's good for sharing knowledge. However, somewhere along the line, we've kind of got to the stage where we kind of hide some of our ideas, where we have a bit of a fear. But maybe it's time that we look the other way and said, well, let's come up with these ideas. Let's see if they can work. Because moonshots are out there, and we need just a space for people to share that. And I hope that's what we've enabled.
Yes. I love the fact that we're starting with yourself, looking after yourself and looking after the people within the community, and then how that can have a ripple effect on the wider world. This is how we can make the world a better place for us now and for the future generations. And I guess that's what one of the WHIS vision is actually to how you can leave a legacy behind and help the future generations to create that peace within themselves, within you, but also within your community, family, and the country and the wider world. So I would like to come to you, Jackie, because I know that we have had a number of conversations in the past, and we have talked about emotional intelligence and also how we can help children to start off at the very beginning, and create these techniques, these steps by step, where they can understand more, connect more with their emotions. So how do you see yourself connecting with WHIS, and your sort of take on supporting children and schools and teachers?
Well, I think for me, my mission in life is to reach as many children as I can. And I suppose being part of WHIS, what it showed me is that I have the ability to be part of that, even whether it's collaborating. I was in talks with one of the ladies, Sunny, yesterday. We were just messaging about possibly collaborating to create a team program, which is going to go out, on a wider scale. So that is me creating my mission there, and that, I can actually reach kids around the world just by collaborating and those programs going out. And just one little element that I might do might have a global difference, which it doesn't matter how it happens as long as it happens. So that for me is helping these children, the next generation, to be more of who they're meant to be more of their potential, and to be able to navigate life's challenges and difficulties much easier, so they can be that potential. So that is my mission, really, and why that's part of what I'm doing is to do that. But also on the wider scale, because it's a whole child approach for me, you've got to work with those people around them, so the parents, the educationalists, and other professionals that work with children. They also need the same empowerment, the same understanding, the same emotional intelligence, so that the kids can rise, really. or rise and shine. That was a word that Sue said this week. Rise and shine.
Rise and shine, absolutely. Absolutely. Said, you are actually based in Nottingham, and you are very much involved with Nottingham, including Jackie and Sue. So what steps have you taken so far?
Well, we've done quite a bit actually in Nottingham already. We've been planning an event in March, but before the event, we've already started to look at putting the WHIS Kids program together. So Jackie's very much moving forward with the WHIS Kids program, and we've also done something quite interesting, which is the platform for what WHIS is about: innovation and locally thinking of ways that can have an impact. So, for example, with my background in media and events and some of the things, and Jackie's background in well-being and health, we came up with the idea of doing something called WHIS into Work, which is not necessarily one of the main WHIS programs, but again, because Gareth is open, WHIS is about open innovation. We've been able to put that together, and it's something now that we hope to develop and implement in Nottingham, but then can be scaled up and can be shared. And another conversation that me and Jackie was having was that the beauty is that we can share things that people are doing in other parts of WHIS, and it's very open and collaborative. There's no, like, when we develop something, it's a pleasure for people to take on and go and do it somewhere else, and tweak it and make it better, and that's something that we're doing. So things in Nottingham that we're doing is a team. We've got a fantastic team of people together: Sue and Jackie and Maxine and Irfan, who's not here at the moment. But it's again, it's like-minded people coming together, and now we've got that core team of people. I think the next things are happening quite quickly, so there is a lot to do. There's a lot to do, and I think we started with some of the programs that we're looking at doing and developing an event in March, around March time at the Market Square, to launch WHIS. But WHIS is almost already launched. We're just getting on with it. So it's about now. But there will be a launch event which we're planning in March time, and we're going to be looking at mental health as a theme of subject matter for people to come together, which is a very important part of development. So that's where we're at in terms of Nottingham WHIS. And I just wanted to pick up on what Gareth and Sue had said in terms of mirror and empathy, because for the last few weeks, that's what we've been talking about. And it's amazing how we don't necessarily talk about all of these things. We get off, we're very busy, so we talk on the phone and things. So it just hits beautifully when you're listening to people saying the same things that we're talking about here in Nottingham, and we haven't even talked about them. So yeah, for me, very much it's about empathy, and it's something that in my work I try to bring out through drama workshops, because I think that when you empathize, it really is something you remember deeper than when you just take part in a presentation or learn something through different means. So yeah.
Beautiful. So Maxine, somebody, let me just. Maxine, can you hear us? No, you cannot hear us. No, I cannot. There's no response from you.
Hello.
Oh, hello. You're here. Hello. Hi. Hi, Maxine. Hi. Hello. It's probably she can hear us, but it's not a very good signal.
Hello. I can hear you, but I'm having now. Hello. Can you hear me? I just have to listen. I'm having problems. I live in the middle of nowhere, you see, and I'm just not able to connect properly.
Right. Well, what I'm going to do, I'm going to unmute you, Maxine, because there's a lot of noise coming through. Okay, so I'd like to say welcome and thank you for being on the call. Okay, hopefully next time when we're coming together, there will be better signal for you.
Hello.
Yeah, yes, that's what it is. The signal, it was not very good. It is, yeah, okay. Right, so What were we talking about? So let's just so the next steps for you is actually to create something like a big summit. Is it next year now in March, right? Yeah.
It is.
Okay. So in this year, have you got anything else, any events coming up that you would like to share with us, or is all part of the planning and getting all the programs together? Saeed, I'm coming back to you. Yeah.
Yeah. Okay. So yes, there's a lot going on at the moment. It's all about networking and collaboration, and letting people know what WHIS is, because there's so many people that already want to get involved, and as soon as they hear what WHIS is about, they really understand what it's about and they want to get involved. So yes, we're going to be planning for the event. We're going to be looking at the third sector, the public sector, and the private sector getting involved. Very much about collaboration and involvement. There will be opportunities for people to come with stalls and talk about different types of health innovation that they're involved in. So yes, between now and March, it's going to be about planning for the event, but also getting people aware of the World Health Innovation Summit and the World Health Innovation Summit Nottingham. And so we are going to be planning also some opportunities where we go out and talk to people, go to other events, talk to different organisations, including the NHS and the local authorities, to involve everybody in the WHIS, because this is a brilliant opportunity to showcase some of the things that are already happening in Nottingham, like us, like the hub, and so many more things that are happening, and to connect those local organisations with what's already happening in WHIS for the last 2 years is beautiful, because it's about empowerment. So yes, it's about awareness raising between now and the event, and also getting people together to connect and to be part of the event, but also after the event. So it's not just leading up to an event. We want to try and bring everybody together, and we'll also be developing WHIS talks, local WHIS talks for Nottingham, where people can then carry on and come to regular events and talk about the next event, but also what else we can implement within Nottingham locally under WHIS that can have an impact within the community around health. So we definitely want to get this conversation going with local authorities, the local NHS, and the local communities. So grassroots to executive level is definitely the route we want to take. It's very much about making sure that everybody is involved in the process and has that platform. And that's the important key, is giving that platform to people and the voice to local people who are doing things within health that's innovative.
Fantastic. Also, sounds. Okay, hold on a second. I'm just going to unmute like that. Okay. It sounds like there's a lot of scope for growth and expansion, and lots of ideas for creativity and collaboration, and this is amazing, absolutely amazing. And I would love to know more about your next steps and what's happening, and you're very welcome to also join me again on this platform here, but also on the radio shows I host on Redshift Radio on Thursdays between 2 p.m. and 4 p.m. And you can join me at the studio. It will be great to have you all there at the studio. Or you can, if it's too far for you to join me at the studio, you can always phone in for a few minutes. But it would be great to have you all together at the studio and have a very focusing on WHIS and what's happening next. And then we can talk more about collaboration and empathy and creativity and emotional intelligence, and they cover lots of other meditation and lots of other areas that actually are part of what WHIS is about. So at this point, I'd like to ask any of you really, but Gareth, I'd like to come back to you, and if you could share the actual website address where people can find out more about WHIS, or if you got a couple of channels of communication, or Facebook or Twitter, if everything is on your website, then people can connect and follow you and find out more about you.
Sure. It's www.worldhealthinnovationsummit.com. There is at HIC 2016, which is an unusual one. Hashtag WHIS or hashtag Together We Inspire. We've got Facebook World Health Innovation Summit or World Health Innovation Summit. We have WHIS Nottingham as well. With various channels that are out there. I suppose you touched on the basis of scope, and there is wide scope here. So, you know, in terms of collaborations, we are collaborating with, you know, people all over the world, and we're looking at the likes of early detection of dementia, for example. I had hoped Julian Gresser would join us from Harvard this evening, and so we could actually talk a little bit about the research that we're engaged in as well. We're involved in the likes of applications for burnout to support the medical profession, but also the legal profession.
Mm-hmm.
So there is huge scope in our activities, and we're really only scratching the surface here because we're involved in flood alleviation projects, smarter cities. So all of these are new emerging areas. So it's very exciting, and I suppose there is something for everyone in this, and whatever you're passionate about. You know, Jackie mentioned about being passionate about children and how you can network within that space, and she gave examples of how, you know, she was speaking to a colleague yesterday, Sonny, and they're developing, you know, new programs. Sue as well. I mean, I've connected Sue with some influencers around meditation. One doctor, Dr. Zhu, who's based in Hungary, who's worked internationally. You know, Saeed is well aware of our networks locally, nationally, internationally. What's great about this platform is it's something for everyone. So whatever you're passionate about, you can come, you can get involved. It's like an open door, effectively. But the values are what it's all about. We have this saying, trust is the oil of the future. We're very much a values-based organisation that works with honesty and integrity, openness and transparency. That runs right through what we do, and that's how we operate. And it's something that I think everyone on the call here exemplifies, you know. So really, it's a team effort, and you know, hats off to the team as well, because everyone here is working effectively to help their local communities, and that's what we're trying to achieve. Ultimately, the bottom line is to help local people and to establish a network that supports each other.
Yes.
So that gives you a bit of an insight into our dynamics.
Yes, I am fascinated by everything you have achieved so far, but particularly my heart is with kids. This is where my heart is at the moment, and of course there are lots of other possibilities for events and talks, and yeah, that's absolutely amazing, brilliant. So I would like to say a big thank you to all of you, to Sue Cooper, Jackie Wilson, Saeed Ali, Maxie Robinson, and Gareth Bresh for being here with me, the Golden News, on this episode, spreading awareness and understanding of what potential we have on this planet Earth, and how everything starts from you. Everything starts how you look after yourself, and how much you are responsible for your own health. And yeah, we are actually here. We are cooperating together to bring something better for us and for our children and future generations. So a big thank you and lots of love from me, ChriSOULa, the Golden News. Thank you. Bye for now.